What happens anytime somebody ends up getting an injury with their hips or having back pain, injuring their knee, anything like that? They'll go and they'll get the clamshell exercise and they'll lie on their side and they'll do their clamshells, and then they'll get the likes of the glute bridge, which they are great exercises. But when you look at them in isolation, that's just here you're going abduction and here you're going through extension, okay? What we have here in our principles of hip function is that you have extension of the hip, you have flexion of the hip, you have deep flexion, you have lateral movement of the hip as well, how the hips hike up side to side. You also have internal rotation, you have external rotation, and you also have adduction too. So it's not just abduction, it's adduction. And where most people go wrong when it comes to rehab and an injury is they're just doing abduction and extension. They're not trying to improve their deep flexion, they're not trying to improve their internal and external rotation, and they're not trying to improve their adduction as well, so the actual groin. How many of you in here have ever heard of someone having a butt injury? 1, 2, 3 butt injuries? How many in you here have ever heard of someone having a groin injury? Groin? Almost everyone. See the difference there? Weakness in the adductors, and that's what most people miss. Your hip is made up of a bunch of different muscles. It's not just ever one muscle. The ones that are most famous to be blamed is the piriformis muscle, but if you're missing any of these ranges that we're talking about today, that's where the pressure on the piriformis muscle comes from. The joint can't move properly. It's not the muscle itself, it's a limitation with how the joint can move, and that's why the one area is going to be the site of pain. But it's actually the things around it that you need to think about.